My name is James Sweasy. I'm a co-founder here at Evolve Indy in Indianapolis, Indiana, and I want to take a moment to describe to you what a full continuum of care looks like. Whenever you're seeking treatment for drug and alcohol addiction for yourself or a loved one, this would be the entire process. There's several levels of care. It's detox, residential care, intensive outpatient, and then outpatient. Whenever you first come in and you have a lot of narcotics or alcohol in your body, you have to start in detox. We have to medically remove all of those substances from you in a safe environment with nurses checking your vital signs, giving you medication for anxiety, depression, making sure you can sleep while we remove the client from drugs and alcohol. In some extreme cases, residential care is needed after that. This is for very heavy alcohol abuse, very heavy methamphetamine abuse, where the client might need to stay in that detox unit for a longer period of time. So you go to detox, have the drugs and alcohol removed, stay in the detox unit around the medical staff and around the professionals during residential care for monitoring and stabilization after. Once that is complete, you do not have to stay in the same building anymore. You get to step down to partial hospitalization and then on to intensive outpatient. Partial hospitalization is 6 hours a day, 6 days a week. Clients will stay in one of our housing units. We have a men's house and a women's house about 30 to 45 minutes apart, and we have this clinical building. It really is a screenshot of what real life looks like. They wake up in the morning, they make breakfast, they get dressed, make their bed, get into a van, and come over to the clinical building with staff. Do 6 hours of treatment, 6 days a week. Once treatment is complete for that day, they get back in the van, monitored by staff, go back to the house. You do your own cooking, you do your own shopping, you have your own downtime. We go out to movies, parks. We try to keep you busy as if you were in real life out in society. Once you have completed partial hospitalization, you can then step down to intensive outpatient. Intensive outpatient is also 6 days a week, but only 3 hours a day of therapy, 12-step recovery, things of that nature here in the clinical building, and you or your loved one are still staying in our housing units, coming 6 days a week, transported by staff. This is really a step down from 6 hours a day to 3 hours a day, but still maintaining a stable, manageable environment where we can work with the client. Once you've completed partial hospitalization and intensive outpatient, then it's time to step down to outpatient. This is really where the client is no longer living with us. They're back in a transitional living home, a sober living, or back at their house, going to work, continuing on with life out in society, and they come back and do 1 to 3 group sessions per week and 1 individualized therapy session with their primary therapist per week. And in the coming weeks after that, we step them down. Instead of doing that every week, they'll do it every 2 weeks and then down to once a month. And then once outpatient is complete, they can even continue with teletherapy. So for more information on our entire continuum of care and how to step down from one section to another and get back to life, call the number on the website and schedule a tour today.